The health cluster in OPT was activated in 2009, and these have been the toughest 12 months since its existence. We have witnessed the dismantling of a healthcare system, which was already fragile to begin with before the war. Before October 2023, the main health service providers, both in Gaza and the West Bank, were the Ministry of Health and UNRWA. However, since the beginning of the war, health cluster partners have had to scale up their activities in order to meet the increased demands in terms of health service delivery, as well as also the significant challenges that the Ministry of Health and UNRWA have been experiencing during this crisis. In Gaza, the focus has been on providing, or not only managing the trauma cases that have come as a result of injuries, but also providing basic primary healthcare services, managing patients with chronic illnesses, NCDs, MHPSS services to people who are highly traumatized.
One of the main roles for the health cluster is to support health partners in restoration of health services across the Gaza Strip. We've done it with Nasser Hospital. We've started with minimal services, and then we've expanded beyond the minimum health service package, and we continue to expand the bed capacity within the Nasser Hospital. Weekly, the health partners provide health services to over 300,000 beneficiaries, be it primary healthcare or secondary healthcare services.
In the West Bank, our focus has been on management of the injured from military operations, settler violence, as well as also providing basic primary health care to marginalized communities across the West Bank Area C locations.
The current financial crisis going on has affected the Ministry of Health capacity to provide and procure medical supplies and even pay the health workforce. This has resulted in reduced functionality of the health services, with over 65% of the health service points partially functional, and hospitals are functioning only at 70% capacity. The situation has also been worsened by the increased number of attacks on healthcare. The checkpoint closures, movement restrictions, and also issues regarding issuance of permits has continued to make the response complicated and also affected timely and effective delivery of health services by the partners.
Since October 2023, we have had 73 active health cluster partners working tirelessly to respond to the massive needs that we have been seeing in Gaza and the West Bank. These colleagues have endured a lot, including multiple displacements, and many have been killed whilst performing their duties. We want to appreciate all these colleagues for the hard work they have been put and the sacrifices they have made for us to be able to continue providing the much needed humanitarian health services for the population.